going to start,
Yes.
Dr. Akhil and Dr. S.K. Singh. Sir, permit me
Yes,
to
please,
start.
please go ahead.
So, very good morning to all of you. Uh, I can see our Honorable Director, Professor B.R. Mittal, has logged in. So, sir, I welcome you. Dr. S.K. Singh, Dean, Academics, Faculty of Medicine, IMS BHU, has also logged in. Other faculty members, students, it's really my proud privilege to welcome you to this guest lecture. The speaker of this lecture is Professor Akhil Maheshwari. I'm very happy to share that he is our alumnus. He completed his MBBS from IMS BHU from 1988 to 1993. He was a brilliant student. He won honors in biochemistry, forensic medicine, pathology, pharmacology, microbiology, and ENT. He also won the Best Student Award of IMS BHU in the year 1991. Akhil, I remember it correctly. 91.
91.
And he also won so many numerous awards and honors. For MD Pediatrics, he joined PGI Chandigarh, and there he was given the the Pediatric Region Award. After that, he moved out to US. He completed his residency in pediatrics, then fellowship in neonatology, and the rest, as they say, is history. He joined the University of Alabama, then University of Illinois, and most recently, the Johns Hopkins University School of Medicine as professor of pediatrics. He's a wonderful man, great research work, and his area of research has been necrotizing enterocolitis. He has devoted his life to unravel the mystery, the pathogenesis of this dreaded disease, necrotizing enterocolitis. We call Akhil Neck Man because he has done so much of the basic and clinical work and with numerous publications, including in the Nature Communications. And he has tried to unravel the mystery. How does the neck develop? The pathogenesis, the role of platelets, the role of macrophages, and so many other things. He is the founder of the Global Newborn Society, which is a wonderful initiative which brings together not only the medical people, but also the general public. And it is for the well-being and welfare of the newborn babies. He's also the editor of the journal Newborn, which is an Elsevier publication, and it's upcoming. I think in a few months' time we will see this journal. So he has achieved so much. So I'm really happy that he agreed to give a lecture on academic leadership. So he will tell his story, his journey from India to US, the struggle, the challenges he faced. So without wasting any time, I invite Professor Akhil Maheshwari to deliver the talk. Thank you. And please share the screen and then the Akhil, floor is yours.
Yeah, thank you, Professor Ashok Kumar. You know, I'll start by saying that I went to neonatology because of Professor Ashok Kumar. So he was very kind, and he gave me the title for this talk as academic neonatology. But in all humility, I would say, so I asked him, can I pick a slightly different title, which is newborn care experience from only one ongoing journey. And I will explain, the career has gone through several, turns and curves, and there are some differences in which how we traverse the academic path in India and in the United States, and I'll explain all that. Currently, most of my time goes as the chair of the Global Newborn Society, which we are developing. Now we are in 122 countries. And now I'm also the editor-in-chief of an upcoming journal, Newborn, which will be published with Elsevier Publishers. I'm also writing a textbook of neonatology. So those things are taking most of my time. And so, because, there are only 24 hours in a day.
Yeah, that's fine. Go ahead, please.
Okay. So I introduce myself, and then, here. So the question is, what did I want to talk about today? So I wanted to talk about when did I start my small steps? Second is why? Why did I take these small steps? Third is how? How did I take these steps? And the fourth is what am I doing right now or planning to do in future? So the first question is when. And as Professor Kumar said, when is the point? I grew up in a town, Meerut, and in 1988, I moved from Meerut to Varanasi after I completed my high school. In Varanasi, this is the place, and when I was looking for these pictures on the internet, it was like I came back home. This was the entrance at VHU. This is IMS. And this was Ruya Hostel where I went first. I think I was in room 101. Right when you enter the hostel, it was in the right side, right beyond the warden's house. And this was right on the ground floor. I still remember, I close my eyes, I see it. And then in the third year, I think after I gave my first professional exam, I went to Dhanvantri. And I don't remember the room number in Dhanvantri, but those were the best years of my life. This was the Sir Sundar Lal Hospital. I again close my eyes. I can see it. The picture on the left is the front. The picture on the right is at the back. And I finished my second and third professionals. Then I entered internship. And we all know what internship is all about. So there were two things for salvation. One was my spiritual salvation, where in 1993, one is the Ghat on Godolia. That was for the spirit. And on the right side, there was this restaurant called El Chico, which was the salvation for your bacterial flora. And those are the two places, because in El Chico, this is how I removed my bacteria from the intestine. In 93, I started thinking, what do I do in life? And I had all the options for doing residency. I liked two things. One was surgery, because I thought you could actually do something. The other was pediatrics. And in pediatrics, when I did my rotation, it was with Professor Ashok Kumar. And he used to do these evening clinics starting at 7 o'clock and teach us until 10 o'clock at night. And you saw the dedication. And that's when I realized how much you enjoy the company of small babies and young children. I thought I'd do pediatrics. And when I started doing that, I didn't have much to do in internship. I mean, I should say that, but I didn't have much to do. So I ended up giving the entrance exams for AIMS and PGI. And PGI was the best institution at that time for pediatrics. I was very fortunate. I got the seat in PGI. Those were the top 5 seats at PGI in pediatrics. But somehow I got it. It was good luck. And from 1994 to 96, I did my residency. And as I said, I really enjoyed the company of small babies because there was this book called Illingworth, which described how you examine a baby. And you raise the head of a baby by 30 degrees, and suddenly all the reflexes they go away. And you can gaze in the eyes of a small baby, and the baby looks back at you. And this is consistent with all the philosophy that you read in India, that a baby is only limited by the fact that he or she has not learned the ways of the world, but the individual is in there. And so I took pediatrics. After I finished that in residency in Chandigarh, in that year there was no DM seat because they used to take 5 students in, or 5 students in every 6 years or something, or the number of students was lesser than the years. So there was no seat in 97. So 97, I joined as a senior resident, but I spent most of my time in neonatology. 98, I got a seat. It was available. I got into DM of neonatology, but then I realized that I spent most of my time in the neonatal wards. So I didn't have anything new in neonatology in DM. And then I started thinking I want to do something. I wanted to do research. Professor Narang was my division chief, and he was very kind. He took me to a lab in PGI, and there the lab person said, I measure free fatty acids. And you come here with a problem, and I'll help you measure it. And I was thinking that that's not the way I want to do it. I want to ask a question, and I want to find out how I look at the mechanism. So then I started looking at mechanisms. And the only way I could do it was that's when I started thinking that I need to move to US. And in 1990, in 1999, I moved from Chandigarh to US. And I was very fortunate that I got into University of Florida that had a very advanced research program, particularly in hematology. And I was the only foreign graduate in the last 5 years or something, but it was good fortune that I got in there because that had one of the best research programs. And I did my residency. Residency in US is 3 years and you have to repeat it. But with my good fortune, they reduced the length of my residency to 2 years. So I finished it in 2001. And then the mentor I had, I moved with the team from Gainesville to another city in Florida, which is called Tampa, and I continued my research. In 2004, I finished my fellowship, and I'll keep this part very brief because this is essentially recapitulating what I have done, and I just want to introduce myself. I went from an assistant professor position to associate professor, and very fortunately, I could build a program in research. I got funded by several agencies and the NIH. And then 6 years later, I was only a I'd only been in a faculty position for 6 years, but from University of Illinois in Chicago, they said, you want to come as a chief of neonatology. And I thought this is too early. But when I asked my mentor, he's very, humble. He said, Akhil, you should go for it. Because I did this job much later, but I just made a different set of mistakes. If you do it, you will make mistakes, but it'll be different. But the benefit is that you will choose the research you want to do. And so I took this position. 4 years later, a donor came to Tampa. That's where I had done my fellowship. And the Tampa, academicians asked me if I want to come back and establish a large lab. And I went back to Tampa. My research program was still flourishing. All through, I have studied only one disease, and I'll explain that. I went to Florida. In 2014, I developed a lymphoma. But I was able to continue my research. I mean, I was very driven. So I would go to the lab or do my rounds, and in the afternoon, I would get chemotherapy. And life went on. It was fine. But because of that, in 2014, I moved to Johns Hopkins, because I thought that'll secure one part of my treatment. Hopkins has the world's best outcomes in Hodgkin's lymphoma. And I got treated and things went on. And then after 3 years, I started looking for meaning in life because I thought now I have been division chief since 2010. It was 10 years. And I thought like I have survived for a reason. So then I founded this Global Newborn Society. And the funny part is, we did not have a global society, and now we have 122 countries in this. Now I have had a chance to start a new journal. We will call it Newborn. It'll be one of the largest publishing companies, Elsevier, and very fortunately, this has a very strong presence in India. So you probably know about it. But unlike in India, where the system is such that as we make progress, we start thinking of a bigger and bigger institution. In US, the system is different, which actually matched my philosophy. And the system is as you start getting more liberty in what you want to do, you can give up the parts that you don't want. So I actually resigned from Hopkins and I kept my research appointments in there, but I thought that I want to do something global and I want to manage this journal. I kept my research appointments at Hopkins, but I gave up my clinical part. And I joined in Florida in a large system which has 25,000 deliveries. I'm helping them develop a research program and in training, but this gives me time to do what I want to do in life. And we can discuss this later. Now the question is why? The first question was when. The next fundamental question is why. And why neonatology? I have explained some parts of it. The question is, as a physician, if you really ask a question, when is it in a patient's lifespan that we can bring about a change? And you have to forgive me if you have picked a different branch of medicine. This thought process was because I was a pediatrician. And the reason I took neonatology is something I want to explain. Because you have neonatology, you have pediatrics, and you have adult medicine and onwards, like geriatrics. I started thinking that adult medicine is like an old car, which you need to repair. And obviously, if you're an internist, you have to forgive me. But this is how I thought. You have pediatrics, but that's like a new car, and that comes with a warranty. So you don't have to do much. But in neonatology, that is a car that is still being built. And I started thinking it is better to shape than to repair. And that's why I did neonatology. So that is the root of my philosophy. Why research? Because you are an excellent physician, but why research? And in US, the typical clinical team is with 25 babies. I know it's much smaller than in India, but the rounds are more extensive, the note taking is more extensive, the system is different. And when I looked at that 25 baby team, I realized that on 16 of those, I'm not making major decisions. Those are all protocol driven. And anybody could do it. Maybe a senior nurse could do it. I was like, what am I doing here? There are 4 or 5 babies where you make some decision. But then you don't need somebody who has done this for 20 years. Somebody who has done it for 5 years might do it as well. And then for 4 babies, things have gone too far. They were born premature. They already had disability, and I only worked to salvage them. So I started getting a little dissatisfied that how many of my clinical decisions really change outcomes. And you start thinking, am I actually making a change in life? Now, what kind of research do I want to do? So, heart is done by cardiologists, so they don't need me. Lungs, it was a major issue at one point, but once surfactant came in, once ventilators improved, you didn't need lung research. And then the liver is okay in a baby. It is all only damaged after 55 years of age, and all the tonics that I described earlier, that your liver gets damaged. So I didn't want to do liver and I didn't want to do lungs. So there are two organs that are left. One is the brain and one is the intestine. In the brain, the difficulty is when you're comatose, all you're doing is supporting the baby. And you're hoping that the condition will improve. The baby is comatose. On the right side, you see a baby with a gastrointestinal disease. And as I described, then when you look in the eyes of a baby like this, you can feel the pain and you can actually treat this baby. The only problem is that this disease, called necrotizing enterocolitis, we don't know why it happens and how do we treat it. We are still learning. But the pain in the eyes of the baby was something that drove me. And it was very funny. I mean, these are some of the papers, and this is all I have worked on in my life. We published more than 120 papers, written 6 books, blah, blah. The point is, you can actually make a change. And when I think of inflammation, the first cells, this is what I had learned, the first cells that come in are neutrophils. But what we found when we kept our mind open, that the first cells which come in this inflammatory condition are actually monocytes and macrophages. The whole paradigm shifted. These macrophages become activated in terms of inflammation. And this is how most inflammation happened. This is not how I had learned it. So I started getting more and more excited. These small cells are macrophages in an intestine of a normal premature baby. But when you get next, see how enlarged these are? And this is the production of tumor necrosis factor. It's one of the inflammatory factors. And see how green these cells are. They express this, but not in the control. And this is a slide which has merged these two. And you see most of this green stuff is coming from the red cells. All you see is orange.
So, Akhil, can I interrupt you?
Yeah, please.
Yeah. So these, I mean, can you go back to the previous slides? These photographs look beautiful. So
Thank
how
you.
do you stain or isolate these macrophages? Because intestinal macrophages, as I understand, are fundamentally different from macrophages in other body sites. As I understand, macrophages in the intestine do not secrete cytokines as much as the macrophages in other body parts. Because if intestinal macrophages start secreting cytokines, your entire microbiome will be destroyed, and then we will be nowhere. So can you tell us more about how did you identify or stain these macrophages, and where did you publish these papers?
This is why I respect Professor Kumar so much. Such insight. The funny part is, in an adult, if the macrophages interact with bacteria, nothing happens because these cells are mature and they have learned to live in harmony with the bacteria in the intestine. In a premature baby, that has not happened yet. These macrophages are like monocytes in the rest of the body. When they face bacterial products, they react. And that is why a baby is at risk. I learned how to stain these slides, how to separate these macrophages. We developed mouse models and all that because I have remained with one disease. That's how you discover detail. And this is something that I want to bring back to India. But that is a great question, and we can come back to it in detail if needed. The funny part is these macrophages, once you start going into detail, you realize that macrophages, not all macrophages are alike. Macrophages appear in the yolk sac, like 6 weeks in the embryonic period. And then these guys start maturing. Like this is like a painting where you start discovering more detail as you start looking into this. And this is a really busy slide. And I don't want to go into the detail, but this is where you realize that there are so many subtypes. What I called macrophages were not one type of cell. These have to be isolated and studied. And the more premature a baby is, the more are the subtypes. And that is the complexity that I learned when I went to neonatology and when I started doing research. The next question is how? Like, if you want to work on this, how do I manage this? And when you start looking at how, the question starts appearing with management. And that's where leadership comes in. Because alone, you cannot do this. You have to build a team. And when you start thinking of leadership, you start thinking of people. And then I started learning about philosophy of administration. There are 5 kinds of people. One are the pioneers who like and embrace new things. One are supporters who will do it, but they'll do it only when you ask them to do. The third are followers. These guys are wait and see, very careful. They'll stay on the side that is most likely to win. They're not going to do anything else.
I think these are majority followers, Akhil.
They're followers.
If you quantify them, probably followers will be in majority. Yeah.
Absolutely right.
Yeah, go ahead, please. Yes.
The fourth group are skeptics. They will trust data. They're not going to follow you. But the funny part is this is a very important population because if you win over these, that'll convince the followers who are in much larger number. The fifth is this is a funny name. These are cave people. These are citizens against virtually everything. And they don't join, they don't care for anything. They want to collect their paycheck, they want to go home. And that's because maybe they had a repeated experience with failure and they just became, they stopped participating in anything. The question is like, this is what Professor Kumar asked again, what is the percentage? Pioneers are 5%. These guys will take the risk. And I can go to a very interesting Urdu poem. I'll describe it. 10% are supporters. 45%, nearly half, are followers. They have learned not to take any risk. They'll follow you if you're successful. Skeptics are 25%. You have to convince them. But they keep the society running in a good way. Because when you convince the skeptics, that is when you start looking for reason. And 15% are the citizens against virtually everything. They will, if you win over them, that is the biggest success in your life. That's a hard thing. Fortunately, they're only 15%. These three over time can help you do something. Pioneers, supporters, followers. If you get skeptics on your side, then you're awesomely successful. How do you build a group? And there are stages in this. When you join a new place, you have to bring freshness. The easiest thing to do is to bring food. And I like food. So that's why I'm saying this. One is you have breaks during the day when you order tea or coffee or some sweets or something from Lanka.
So, Akhil, do you have samosas in US at your place? I mean,
I found a way. I like food.
Okay, right.
समोसे से बढ़िया कोई चीज नहीं है मतलब समोसा और लंका पे लस्सी
Okay. चलो उसको हाँ उसको बताना बाद में. Yes, that's great. Yes.
है ना first is you take these breaks with refreshment and you can do it twice or thrice a week when you can get lassi from Lanka. The second is you celebrate small successes. Like if somebody did something good, you have to celebrate it because successes are fewer than failures. But when we celebrate even the smallest of successes, it changes the environment. Third is motivate. Leaders have to stay positive and they see small mistakes as learning opportunities, not go negatively about it. And the fourth is recognition. You can say thank you. You can send a text message. You can send an email. Something more important, you can send a formal letter. Doesn't cost you anything. But these four things are what help you to achieve success as a leader. Now, there are two things which you can do once you have established yourself as a leader. One is you can introduce something like an idea collection method, and it can be anonymous. You can put a jar, or you can put an anonymous email box. And lastly, there is appreciation. This is formal appreciation. You can give incentives, you can do perks, you can give certificates of appreciation, you can do a bonus, but you need to be in a position where you can do this. Not everyone can do this, but you can recommend. Now, these two, as I said, are at a later stage. The first is breaks, celebration, motivation, and recognition. And any boss can do that. It doesn't cost you a paisa, but you can do this and it changes the whole atmosphere. This is what is called a recognition pyramid. This is a formal concept in leadership. So 80 to 100%. This is something where you can recognize everybody every day who is doing something good. 30 to 50%. This has an impact. This is informal praise. You can go to that person's office and say, Sanjay, you did something awesome. And this you can do monthly. If you do it too frequently, you lose the impact. But if you don't do it, that is bad. And once a year, you can do a formal recognition. You can call everybody in the department and celebrate that success and say, Anil, this is something that has changed us. This is important. And this is a recognition pyramid. Every system uses it. In medicine, we are not taught about these things, but this is something I'm learning as I go ahead. Now, how do you execute plans? The funny part is, this is a very funny cartoon. This is a guy who is eating soup with a spoon, but he has built this very complex method, and we do this all the time. We have to look at how do we simplify the operation. And this is a machine composed of numerous unrelated devices. This guy picks a spoon of soup. This spoon, when you do this, it is connected to another spoon, which throws up a piece of bread to a bird who is sitting here. When this bird jumps up to catch this bread, then this part, this thing goes down, it throws something into a bucket, and then it moves a bunch of things. And finally, a napkin comes out, which cleans this person's mouth. So you can create an extremely complicated machine to do something similar, simple. And that is something which leaders look at and they simplify this, and the results are amazing. Now, how do you execute plans? The first is vision. You have to think about that. Unless you identified it, you are not going to be able to do it. Then you develop plans, and they can be basic, clinical, applied, whatever you want. That is your priority. You execute them, you evaluate them, and then you modify them. And this goes into a feedback loop. And if you do this, you are a successful leader. Life will go on. Now, the important thing is to learn this. This is a train which is moving on a track. The mistake we make is we think that the guy who drives the train is the leader. The real job is actually laying the track. The person who drives the train is not as qualified. It is laying the track which is critical. Now, what do I do? And that is the question I started facing after 10 or 11 years of being in neonatology. This question became very important for me because in the United States, neonatology is a very rewarding branch. But the overall pediatrics becomes a little chaotic. So I started searching for meaning. And when I started thinking of what, I started thinking again of the same paradigm that most of your decisions are routine. Some decisions make a difference, but anybody could make that decision. And some decisions are not going to retrieve anything. You make those decisions, life goes on. So we developed this global newborn society. We are now in 122 countries. If you go to the website globalnewbornsociety.org, you will see more of this. There are programs which we have developed and are developing. There are consensus statements, there are publications, there's new research, and so on. If you go to the website, you can look at it. We're developing a new journal. This will come out with Elsevier. But one thing I want to fix is that right now, if you know English well, it puts you on a pathway to success. You may be doing the most brilliant job, but you can be limited by linguistic limitations. And if you live in China, or you live in Russia, or you live in Southeast Asia, English is not even to the extent that we have in India. And that's why research is very hard to do. And that's what we want to fix. What are we doing right now? These are all the topics of research. You can go to the website, look at them. This is something we have arbitrarily developed based on the topic, the system. And each of these is a clickable button on the website, and this will give you more information. We're developing collaborations, and these are some of the societies which are from Egypt to Mongolia to Latin America. And this is something we're doing. If you click on each of these, you will find information.
So, Akhil, can I interrupt you? No.
Yeah, please.
As I understand, in US or European countries, you work in one place and you can also contribute to other medical institutions or centers.
Yes.
So how do you do it? I mean, what is the mechanism? Like in India, if I'm in BHU, I can do work only in BHU. I have no mechanism or system of giving my services or my intellectual input to other places, other institutions. So,
Professor Kumar, yeah. Sorry, I didn't mean to interrupt you.
yeah, please go ahead now. Yeah.
No, Professor Kumar, that's a very important question because suppose I work in one institution and I want to go somewhere to contribute. You know that a 2 hour meeting or a 2 hour presentation is not going to change anything. You have to go there for a week. But if you go there for a week, in most institutions, you will be using your vacation. And you have only so much vacation and you need to use it for family also. So what many institutions in the United States are doing is that they're giving adjunct appointments to faculty. You don't pay them any rupee. But the point is there is an honorary appointment. And when you negotiate a position, you can say that I have an adjunct position at BHU India. And then I can go there for a week and start a program, teach students, and do everything but not lose my vacation. And that is extremely important. That will attract the best leaders in the world. And I did not know this when I was in India. And I think BHU, it's a wonderful place. Who doesn't want to go to Varanasi? The point is the university should seriously think about creating these adjunct positions because it doesn't cost anything, but
Okay.
it pave the way.
Okay. So it's a
Now,
very interesting. So,
yeah, please.
yeah, so I have one more question to you, Akhil. Uh, you were a brilliant student, no doubt in it. Very remarkable. Uh, your academic career. But don't you think you left India and went to US? So kind of brain drain. So what do you think? What is your take on this? I wish you could have stayed in India and contributed so much to our society, to our nation building, with your brilliance, with your original ideas, with your creativity. So what's your take on this?
So there are two aspects to this. It's a very important question. One is that yes, I have some guilt that when I left India, but I also would not have learned the research I do, the thinking, because I got a chance to work with some of the world's biggest leaders. And now there are a lot of people who are in my situation. Now, if we are in BHU, I think one way to would be to bring these people back for small period so that our residents, our students, our DM students get to interact with them. And leadership is a feed forward cycle. So, so the thing would be that if we build a mechanism of bringing them back for a week, most of us would pay for our flights. The only thing is a place to stay and some time for the trainees to get a chance to interact with them. I think, and I'll show a slide at the end.
I think it's
It's
a
a
very good
very,
idea. Very good
yeah,
idea. Yeah, I appreciate it. Yes, we need to explore it actively. This
yeah.
adjunct position universities in India. Yes,
I
thank you
think
for.
we can get a lot of leaders from the world who have spent their life learning this. And I think we should not lose on that opportunity.
Okay.
Who doesn't want to come back to Varanasi? It's the spiritual capital of the world. And I would want to come back because I want to go to Godolia. So
Okay. Yeah.
when you look at resources, we are developing that. We have started an email service because then you get connected to everybody. We have developed a global RedCap consortium. And you had mentioned that we have this RedCap database for BHU. But if
Yes.
we
Yes. Yes. Yes.
join, we will join 122 countries, a change in scale. And that's what we need to do.
Thank you. Go ahead, please. Yeah.
What can I do to share ideas? We have started a service on the Telegram Messenger. You download this app, Telegram. It's a free app. Download it on your phone and Google Global Newborn Society or email me, Akhil at globalnewbornsociety.org. And I'll set this up. It's not a problem, but larger the community, the easier it is to ask questions. And I want to thank two people. One of them is you, because you taught me how to examine a newborn baby, and you taught me when you didn't have to do it. You taught me from 7 p.m. to 10 p.m. when you could be having dinner at home or watching TV, but you did it. The second person I want to thank is Dr. Sanjay Singh. He is a professor in dermatology. He was the one who taught me how to read. He taught me how to underline in a book. His dermatology book is a 3 volume book, a huge book. He was the one who read it cover to cover. And that's what I still do to this day. He molded me. And that is what I want to thank. I'm very lucky that I've been able to stay in touch with you. And but I want to acknowledge that some of these events change your life. And I want to thank Dr. Sanjay Singh. I don't know if he has been able to join. And I
Yeah, I
want
think
to
he joined. Yeah, Sanjay, are you there?
Akhil, I am here.
Oh,
yes,
see, he's here.
I
I think
want
we should have a lecture by Sanjay on underlining and how to underline the book.
to
Yeah, that would be wonderful.
and
And
mentor
I
because
think I think उसने मुझे नहीं बताया अदर I would have gone to America मुझे लगता है उसके बाद वो
well,
Thank you, Dr. Ashok.
Dr. Sanjay Singh was a third year resident and I was a second year medical student. He didn't have to talk to me. He didn't have any need. But he rode his bicycle and he taught me how to read. And where I am today is because of the two of you. Then, धन्यवाद.
Thank you very
And
much.
आपने एक सवाल पूछा था मुझे, एक सवाल पूछा था, मैं उसका ना पूरा आंसर देता हूँ.
Yeah.
सर सवाल ये है, ये मेरी चुराई हुई पोएम है.
Okay.
फैज अहमद, फैज इज अ वेल नोन पर्सन, सो मैं बोलता हूँ कि व्हाट वुड फैज से, है ना भाई, सच्चाई है, चोरी की भी पोएम है. फैज might have asked you कि what is the traditional view of taking a safe path?
Yeah.
And somebody wrote, I don't know who wrote it, I stole it from the internet.
Okay.
कुछ लोग तुम्हें समझाएंगे जो तुमको खौफ दिलाएंगे कि जो है वो भी खो सकता है. कुछ लोग तुम्हें समझाएंगे जो तुमको डराएंगे कि जो तुम्हारे पास है वो भी खो दोगे. इस राह में रहजन है इतने, रहजन मीन्स डाकू, कि जिस सड़क पे आप जा रहे हो वहां पे डाकू छुपे हुए और कुछ और यहाँ हो सकता है. This is a traditional view about taking a safe path, that don't do anything which is unknown. Just go on the path that people have taken and don't take any risks. And what I have learned and I have followed in my life, अरे अब कुछ और तो अक्सर होता है, पर तुम जिस लम्हे में जिंदा हो वो लम्हा तुमसे जिंदा है. ये वक्त नहीं फिर आएगा, तुम अपनी करनी कर गुजरो, जो होगा देखा जाएगा.
Excellent, Akhil. I think, wow, great. I love it. Love these words.
You have to take risks. Otherwise, nothing will change.
मुझे लग रहा है कि जैसे आप अमेरिका में हिंदुस्तान के किसी कॉर्नर में बैठे हो जाकर ऐसे बातें कर रहे हो जाकर के. It looks so wonderful. I'm really grateful. It was a remarkable in the deliberations, and I'm sure the participants would have enjoyed it. I'm so much thankful to you. We are right in the time. बिल्कुल अभी 8:59 हो रहा है जाकर के. Though initial there was some hitch was there in starting, but that happens with modern technology. But it's so grateful to you, Akhil. And I'm sure जो आपने आज बोला है उसके लिए people would be, I mean, wanting you to speak again on the same platform maybe next time, right? So we will be really grateful to you. And I would see that if we can have some adjunct faculty positions in Banaras Hindu University, where we can invite you and you come here for maybe 1 or 2 weeks and train our faculties and resident doctors. So that way you will be helping us and you will be repaying back to your alma mater and country. If there are any questions, big questions, then it's open. If someone wants to ask questions, most welcome.
Akhil.
Akhil.
This is Sanjay.
I wanted to thank you. You have changed my life.
Sanjay, go ahead, please, with your question, please.
Yeah, Akhil, no question, just sending love to Akhil.
Okay, that's great. I see Dr. Rahul Khanna. Dr. Rahul, you have any question to Akhil? Rahul,
yes, Akhil, brilliant.
Surgery, and he ended up in pediatrics. So that's the loss to surgery and gain to pediatrics.
But all the best, Akhil.
Yes, Rahul,
Akhil, you very extensive gained here in India, and then the best of America also you saw. So ultimately, I want to ask something fundamental. What do you think is the reason why India has failed to throw up good original concepts or ideas for the last 100 years or so, not just for the last 10 years? So there's hardly any new good concept or original idea which India can claim to have its own. And not just India, about 60% of the world does not throw up any good idea. It's all confined to most of Europe, Japan, maybe part of Russia, where new concepts will come up. What do you think? Let's take your own example. Now
पहले तो आपको थैंक्स बोलना है क्योंकि आपने मुझे बहुत पढ़ाया था, तो थैंक यू. अगर दूसरा सवाल जो है ना, दूसरा सवाल आप
like what Professor Ashok said, you're a world authority on something like necrotizing enterocolitis. Now, if you take this particular subject on which you are a world authority, so the incidence and also the case fatality rate of necrotizing colitis in newborns would be several times more in India compared to where you are working. But still, your
Yes.
world authority work comes out from America, not from India. So, can you
Yeah.
answer this? Like, what's the reason? What, in your opinion, is the reason for this?
I think एक ही reason है कि it's a question of making a tradition. क्योंकि जब it's something you pass on. Like जब मैं इंडिया से गया था तब तो मुझे पाइपेट पकड़ना भी नहीं आता. And
Okay.
there's somebody who helped. And then I am passing it on to another student. So there is nothing magical about it. There is no Nobel Prize in this. जो सीखना है ना उस वो भी सिखाते हैं सोचना सो वो भी सिखाते हैं and it is not hard at all. तो सवाल ये है कि अगर हम कोई डिस्क्रिपेंसी देख रहे हैं then how do you think of outcome? And this can be easily taught. There is nothing magical. There are only, it's like a multiple choice question in each problem. That is what I've learned. That if you're seeing cellular necrosis, then the point is I have to go to the Department of Pathology, ask somebody to teach me how to look at a slide, and then I have to ask that if there is necrosis, what are the possibilities? It becomes a multiple choice question. And then you follow that. जो दूसरी चीज है वो डेप्थ है. जैसे इंडिया में ना मतलब लोग मुझे ये कहते थे कि भाई हम नेक्रोटाइजिंग एंटेरोकोलाइटिस देख रहे हैं तो हम नेक्रोसिस भी देख रहे हैं, इन्फ्लेमेशन भी देख रहे हैं, थ्रोम्बोसिस भी देख रहे हैं. जो मैंने यहाँ पे सीखा है वो ये है कि मैं इन्फ्लेमेशन स्टडी करता हूँ. तो मैं इन्फ्लेमेशन ही स्टडी कर रहा हूँ क्योंकि सच्चाई ये है कि मैक्रोफेजेस में भी 10 सब टाइप. So I think you have to just immerse yourself and that is something I want to teach students. कि success will follow you. Just immerse yourself in what you do.
Thank you, Akhil.
Okay, I'll ask you.
Dr. Rahul.
Like, what do you think thought process that you possessed in India, the way you thought about things, questions, and the thought process that you now use in America, the way you think about a problem, are they different? This is a very fundamental thing. The answer would lie here, I think. The way you think about a problem, the way you approach it, your thought process on a subject. And so, is it actually totally different in America compared to what you did in India? The thought process part, not
It's a
physical.
very important question, Akhil, for you to answer. What separates India from America? The thinking process, the creativity, the originality. Why we are not able to achieve those things?
सर इसमें ना there is nothing again magical. क्योंकि जैसे सर्जरी में है इंडिया में जैसे पेशेंट्स इतनी सर्जरी होती है and the skill level is I think is probably higher than many countries. The same thing is for research. I think it's a very teachable process and something which can be easily brought in. We have to build the systems. अभी क्या हो रहा है इंडिया में भी और मिडिल ईस्ट में भी और बाकी भी to gain minutes, what people do is they will create a conference and they will invite 5 or 6 or 10 speakers who will come and speak. But they'll come and speak for 1 hour. That doesn't do anything. I think we have to build a system where people are ready to commit a week or 2 weeks. And they will come and find the most promising people and will be willing to donate their time. क्योंकि मैं 1 बजे अगर खाना खाने के बाद गया कॉन्फ्रेंस हो सकता है उस टाइम मेरा दिमाग इतना काम ना कर रहा हो अगर वो बंदा रह रहा है वहां पे तो मैं उसे 5 बजे फोन कर सकता हूँ because I think the exposure needs to increase. And I think the good thing is जब मैं अमेरिका आया था तब most Indians were in rural areas who were primarily in clinical practice. But up maybe 5% Indians are in senior academic position. What we have to do is we have to identify them that are they willing to give their time. अगर वो time देना चाहते हैं, then we have to grab this opportunity. क्योंकि why not?
Okay, thank you, Akhil. Any other question from students or faculties? I also see faculty from AIMS Rishikesh, Dr. Shilparna Basu. Shilparna, are you still
Thank
logged in? Do you have any question from Akhil? Shilparna, you have to first unmute yourself. Okay, so we finished this program. Thank you very much, Akhil. It was a wonderful talk. Very remarkable story we have heard from you. And in future, we will be in communication with you. And maybe next time, very soon, we will again use this platform to talk to the BHU people. Neeraj has to say something. Thank you.
Thank you, boss. We had a very nice. I was being junior to you, so it was very nice interacting with you those 5 years. And we met in Chandigarh also when my brother-in-law was there. So you just joined there. So it was very
इतना
nice.
इतना अच्छा लग रहा है देख के सबको ऐसा लग रहा है घर आ गया हो.
Okay. Thank you.
Thank you, boss. Thank you.
Thank you very much.
Welcome.
Thank you.
you, okay.
Thank you for inviting me. It was a
Bye-bye.
pleasure.